once everybody's connected to audio, I'll do a introduction.
Sure, we got 30 people in here. That's awesome.
Yeah. Okay, I think a lot of people are connected to audio. And hi, welcome, Dr. Siyab. Is that how I pronounce your name? I was listening to you say it in the videos. I want to make sure I'm saying it correctly. Is that how I pronounce your last
You
name?
can call me Siyab, is fine.
Yeah. Okay. Okay, great.
Yeah.
Okay. And he is a cardiologist and also makes a lot of great heart-related content on social media. And we've been like virtual friends for like a
long time.
A long time. And I've just loved actually your approach to such a
longer than a year.
Longer than a year. I've loved your approach, like debunking.
I think.
Oh, yeah. What were you saying?
Sorry, one thing. I think, is it the connection from your end? Because you're cutting in and out. I don't know if I'm also cutting in and out or not, but.
You're not cutting in and out for me.
Because you're glitching your video and audio, but it's okay now. Sorry, go ahead.
Oh, I'm sorry about that. I hear you clearly, but I could always try to move to a different room. Well, I was saying.
No, it looks good now.
Okay, good. Well, I can pass it over to you. I was just saying in introduction that I've really loved your videos on social media, debunking myths, and just your approach to so many topics. I felt like I was in agreement with so many things you've shared. And then you recently posted a video, stitching two videos with people experiencing heart symptoms. And because you do a lot of heart related content, obviously being a cardiologist, this one you stitched and you started talking about health anxiety. And I really loved just everything. You know, that people have real symptoms. So it's not like, oh, this is this imaginary thing that people are experiencing. And so in that video, those people have gotten a lot of tests and come back and would say, oh, this is anxiety. And I've seen that with a lot of people that I've worked with who have had real symptoms in their heart from a lot of the things that you talked about or that you've seen. And so I just thought we would have a chat, and you were so kind to say that. And so starting off with a caveat, this is not a substitute for medical advice. This is not your doctor. This is not, I'm not obviously a doctor. This was just a helpful, informative chat. And so maybe I'll pass it over to you. You'll share, and then we can open it up to questions.
Yeah.
Okay, great. Thank you.
Yeah, sounds great. Well, thanks again for having me. And when you reached out to me, I was like, we should absolutely do this because this is a huge topic and it's kind of underserved and under-recognized almost. And, you know, I just want to reiterate what Lily said. You know, none of this, obviously, what I talk about on TikTok, social media is not medical advice, just general advice. So please don't ask personal medical questions about your specific condition. I can't answer them. I won't answer them. That happens a lot, unfortunately. But it is still important to talk about. And this is something that I talk about on TikTok quite a bit. I'm a cardiologist, Dr. Siyab, MD on TikTok and Instagram. So if you don't, want to go ahead and check me out on both platforms, do go ahead. And I talk about, I'm an interventional cardiologist. So I put stents in people's hearts when they come to me with heart attacks and stuff. And I also have a big general cardiology practice. So I see everybody from the 25-year-old with, anxiety related chest pain and palpitations to everybody else. So, and I didn't have anything formally prepared for this, so I'm just going to sort of spitball here how I think about health anxiety and cardiac anxiety. And people have questions, we can always go through them. So health anxiety, is a real thing, right? So it's part of an anxiety in terms of what health anxiety specifically is, or I guess cardiac anxiety specifically is this always constant feeling that you might have that something is wrong with the heart, with your heart. So every little, twinge that you might get in your chest, or every little pain, or little, random, you shift places in bed, you turn over in bed, you have a little discomfort in your chest, you start thinking, am I having a heart attack, or am I having some major heart issue right now? Or every time you start walking and you get a little short of breath, you're out of breath, whatever it is, you start wondering if you're having a heart attack, right? So that's that constant heightened awareness. And it's not just heightened awareness, it's also significant, it's almost like a panic attack almost, and I'll get to that part too. But the condition that you're worried that you have is heart disease or heart attacks, which are life threatening, right? So the idea that, oh, I could have something that could kill me in the next 5 seconds or 5 minutes, that, along with the idea that there could be something wrong with you, period, but the idea that it's something life threatening that could seriously damage you or kill you in the next few minutes, that kind of just sets off, I guess, a vicious cycle of sort of you just sort of, and I'm sure some of y'all understand what I'm talking about, cycle of sort of anxiety feelings and doom feelings and feelings that something is wrong. And it's just a vicious cycle because it gets worse, because the more anxious you get, the worse the symptoms get, and the worse the symptoms get, the more anxious you get. So it's just continued cycle. So it's very important that we recognize that. And what complicates this is also the fact that a lot of the symptoms of anxiety, when it relates to heart disease and heart anxiety, they are very similar to like actual heart problem symptoms. So there's a big the Venn diagram has a big overlap, right? So the perfect example of this is people that have palpitations, right? Or feelings of funny heart rhythms or skipping beats or whatever you might have. That can be from actual heart rhythm abnormalities. So you might have an abnormal heart rhythm that might be causing that, which is an actual, organic problem with the heart. So rhythms like you could have atrial fibrillation, you could have SVT, you could have any one of things, many heart rhythms that could be causing those abnormalities. Or there's actually nothing wrong with the heart's rhythm. It's all normal rhythm, but there's some sort of neurological, neuropsychological aspect to it that's making you feel that way. At the end of the day, just to bring this back, anxiety is a very real medical condition, and it can manifest in many different ways, in physical ways. And one of the ways that it can manifest is with heart symptoms. So, people that have anxiety disorders often have panic attacks, right? And I know that those are sort of separate things, but one of the most panic attacks are sometimes very commonly confused with heart attacks, right? Because the symptoms can be similar. So what I try to do on social media, and I guess what I want to do here, is just talk about some of these things and how you can maybe, first of all, identify, right, what could be anxiety versus what is actual heart disease. You can't always tell, but how you can maybe tell the differences between the two. And the second thing is sort of all the workup and testing that we do for heart disease. And then the third thing is, how do you, if you've had all the workup and all the testing and multiple testing done, how do you sort of, how can you maybe work to sort of convince yourself the next time that something like this happens that, hey, Liz, I've had all the testing done. Maybe it's just sort of my anxiety, and take a deep breath and things like that. How do you manage that? Basically, that's what I'm talking about. And then one of the last things I wanted to touch on today was, how do we differentiate panic attacks from heart attacks? Because it's a very difficult topic to talk about on social media, but it is something important, and it's something that's relevant to a lot of people. So just basically, heart anxiety is basically, as I said, just sort of anxiety disorder that manifests as heart symptoms, right? So anybody that has any symptoms of possible heart disease, palpitations, chest pain, shortness of breath, whatever it is, everybody should get at least some sort of basic workup or basic testing, right? So no doctor should, by default, blame your symptoms on anxiety, right, without at least doing some basic testing. And that's wrong. And that happens, unfortunately, but that's wrong. And what testing you need, or what degree of extent of testing you need, or how many tests you need, are going to depend, obviously, on what symptoms you're having, your risk factors, your age, your family history, things like that. But basically, what we're trying to do is trying to figure out that if you're having chest pain, right, let's say chest discomfort or shortness of breath or whatever, what is the likelihood that that is caused by heart disease? And by heart disease, I mean either blockages in the arteries of the heart, so coronary artery disease, or some sort of other heart problem, like a valve issue, right? The valves, you may have a leaky valve, or there may be an abnormal heart rhythm. So we just got to figure out, is there an organic problem with the heart? And by organic, I mean like a mechanical issue with the heart, like a blockage, or valve doesn't work well, or there's an abnormal heart rhythm, right? And that sort of testing, as I said, depends a lot on, everybody's different, right? So if you, for example, I get a lot of people in my clinic coming to me, they're 20, they're 30, they're 40 years old. They come to me with complaints of palpitations and chest pains, right? So what I do is I take a very detailed history, and I've made a couple of videos about this on my TikTok channel too, about how I evaluate palpitations. And one of the most important parts, and palpitations are important because people with anxiety disorder will have a lot of palpitations. They'll often have these feelings of, funny heartbeats or skipped heartbeats or similar symptoms, either randomly throughout the day or during a time of high stress. So part of my job is to sort of distinguish, as a cardiologist, my job is to distinguish, okay, what is the likelihood that there's sort of an organic issue with the heart? So I ask a lot of very detailed questions. I ask people, what does this feel like? So I ask them to tell me exactly what they feel. And everybody's different. So palpitation is a term, is very broad, and it means different things to different people. It could mean a fluttering heartbeat to one person. It could mean something totally different to another person. So I asked them in great detail what it means. And I basically spent 20 or 30 minutes trying to talk to them about, just very specifically tell me exactly what happens, when it happens, what are you doing at the time? Are there any stresses in your life, that are maybe contributing to this? Do you take any caffeine? Do you take any, do you use any drugs, right? Things like that, try to figure out what might be causing it. And then based on that, I will do some basic testing, and that might include, most commonly, giving people an event monitor, which is a little patch that you put on your chest for 2 weeks or so, 1 or 2 weeks, and that records your heart rhythm for that period of time. And that's usually the most common test that we do for people that we think might have anxiety related heart issues, because a lot of the times these are palpitations, right? So what I want to make sure is that there's no heart rhythm issue. There's not an abnormal issue. And then when they return to the monitor, I can actually tell. They press a little button on the device, and the button, whenever they feel whatever, right? So, and I'm going into detail into this because I'm trying to tell you guys how I think about these things. And when you press the button on the device, you press the button when you are, let's say, feeling the palpitations, or when you're feeling the fluttering, or whatever you're feeling, right? You press the button. And then I can tell on my end, after you turn it in, is what is the rhythm of the heart during that time, right? Sometimes people have SVT, which is supraventricular tachycardia, which is a abnormal rhythm of the heart that comes on very randomly, very suddenly, and then it stays for a few seconds and then goes off. So it's very quick onset, very quick offset within a couple of seconds. And the way people will tell me how it feels is it'll have like a couple seconds of sharp chest pain or a rush or just shortness of breath, and it goes away within a few seconds. So sometimes that's correlated with SVT, right? Some people have atrial fibrillation, some people have atrial flutter, et cetera, et cetera. So then I know that there is an abnormal rhythm that's responsible for their symptoms. A lot of the times the rhythm is normal, absolutely normal. There is no abnormality in the rhythm, right? It's completely normal. Or they have a little extra heartbeat called a PVC, right? And most of the time, these extra heartbeats, with the vast majority of the time, these extra heartbeats are not dangerous. They are not life-threatening. They are not a big deal most of the time. They don't cause any major issues unless they are happening very often. Like one of the things I like to remind people of is that in an average day, your heart will beat over 120,000 times. If you estimate an average heart rate of about 80 beats per minute, right? So that's about 120,000 beats per minute. So your heart is putting in a lot of work on a daily basis. So if you are living, imagine you're living if you live to 40 years, your heart has already had 1.5 billion heartbeats in that time. So that's a lot of heartbeats, right? And your heart is doing this every single day, every single hour, every single minute. Is just doing it on its own. So you don't even have to think about it, right? It just does it on its own. You don't have to think about it. And out of those 120,000 beats a day, there are going to be 1 or 2 or 5 or 6 beats that are kind of like, skipped or extra or this or that. And that's completely normal. Because you can imagine that you're going to have some degree of aberrancy, right? And that's totally fine. Unless the PVCs are happening too often or something like that. That's a different story. But what I like to sort of reassure people with when it comes to PVCs in general is that they're harmless. They don't kill you. They're not life-threatening. They can be annoying. They can be a nuisance because you feel them. That's different, right? But they're not. The anxiety that people have related to those is this going to kill me, right? Or is this going to cause me significant harm? So most of the time they don't. Now, you can still feel them if you're having PVCs or SVT for that matter, but we can treat that with medication most of the time, right? So treating the symptomatic part. Now, that's assuming that you have these abnormal rhythms. Sometimes you don't. Sometimes they're normal rhythm, right? There's nothing, no abnormal rhythm. With that, it could be part of an anxiety syndrome as well. You could have heart anxiety, you could have health anxiety, or you could have a lot of stress in your life going on from another source. I've had patients that are going through divorces. I've had patients that are going through, layoffs, or their jobs are tough, or they have, they're not sleeping, et cetera, et cetera. So any kind of stress can manifest very easily as palpitations, or just sort of feelings of fluttering or abnormal feelings. And it's our job to make sure that it's not anything organic with the heart. Now, I might also do a stress test to sort of make sure that there's no evidence of blockages or anything like that, depending on the person. Obviously, none of this is medical advice again. Or I might do an ultrasound as well to make sure that there's no problems with the structure of the heart. Now, all of this testing, and not everybody gets the same testing, but everybody should get some appropriate testing, is done to make sure that there's no actual issue with the heart. And a lot of people do have issues with the heart. We find them out, we treat them, and they're good. A lot of the times they have no abnormal issues with the heart, right? So at that point, the way that I like to tell people is, you're still having symptoms. Absolutely. I'm not denying, nobody's denying that I'm not denying that you're having symptoms. Your symptoms are real. However, the testing that we have done it shows that it is very unlikely that there is an organic or mechanical problem or anything actually wrong with the heart that's causing your symptoms. Now, this is very important, the way that I talk about this, because people feel like their symptoms are being ignored, right? Or they feel gaslit. So it is very important for doctors and healthcare workers not to deny the symptoms. The symptoms are real, right? No, I'm not saying your symptoms, I'm not saying you're lying about your symptoms. You are feeling how you're feeling. But my job is to see if there's anything actually going on with the heart, right, that's causing that. And we've done all this testing, right? Even a coronary and heart catheterization sometimes. And I've done those. Even though if I'm not convinced. I've done it just to make sure I've done everything, to make sure I've done all the workup. And sometimes people get multiple of these things, right? They get multiple ultrasounds. And some of you might recognize that: multiple ultrasounds, multiple event monitors, multiple, stress tests, and everything is negative, right? So in that case, and again, these tests are not 100% accurate. Of course, every test has an accuracy, limitation. But if you've had multiple tests done for the heart, the likelihood that they're all normal, or they're all very mildly abnormal, the likelihood that it is your heart is actually very, very, very low. And I think that's one of the first things that people, if you can try to sort of recognize that, if you've had heart anxiety or health anxiety or cardiac anxiety, and you've had all this testing done, and it's all normal. But if you can recognize that, hey, listen, I've had all of this testing done and everything is normal, right? That, I think, is a really good way to sort of help maybe understand your condition better and manage it better. Because if you hadn't had all this done, then you wouldn't know, right? And the fact that you took the initiative, and hopefully you found a doctor that did care and did all this testing. So you worked together with your healthcare provider to get all this testing done, right? So you kind of went ahead and you did all of this work, right? To check it out, to check your heart out, and you got it checked, and there wasn't much, the testing has been normal. Now, is it possible that yes, a stress test is negative and you can still have a heart attack the next day? Absolutely, it's possible. I don't have a crystal ball. I can't tell the future, right? Like, you can walk. I mean, at the end of the day, you'll have to live life, right, at some point, because you could walk outside tomorrow and you could get run over by a car. You don't know what's going to happen, right? But when we go through life, you sort of take educated, sort of make an informed decision, but you got to have the information. So you have all of the information from the testing, and then you make a decision based on that, right? So you can have, unfortunately, you can have a stress test that's normal, that says everything is good, and then you have a heart attack 6 months later. And I've seen that happen. That happens not very commonly, but it does. But that's just how life is, unfortunately, and we can't predict everything. But we can reduce the risk as much as possible and try to identify things as much as possible. So there's that. Now, the next thing I wanted to talk about is, so if you've had all the testing possible, right, everything is good, and you're still having your symptoms, it is always worth it to get it. As I'm assuming that all the other body systems have already been checked out, right? So it could be, because there's a lot of things from the skin until you get to the heart. You have the skin, you have the cartilage, you have the bone, you have the lungs, you have the pericardium, you have the pleura, which are the lining of the lungs. So there's a lot of other things that could be causing the pain, right? Or whatever discomfort you're having. So some examples, this is not a comprehensive list: costochondritis, pleuritis, things like that. So I'm assuming that all of that has been taken care of. There's nothing there that we've identified. And it's always worth it, I think, to get an evaluation for anxiety. I think there's no shame in that, right? Because a lot of us have it. I probably have it. I've had it in the past, and I've actually sought help as well. But it's worth it to get evaluated and see that if you again, I'm not a licensed mental health practitioner, but if you do have it, getting treatment for it, whether that is sort of with sort of, you know, therapy or medication or whatever that is, can really help symptoms a lot. Because again, anxiety manifests as physical symptoms, and those physical symptoms can be cardiac symptoms. And, you know, identifying things like stressors and trying to work to reduce those stressors if possible. And this also kind of includes, you know, dietary things, right? People don't realize a lot of the times how much caffeine they're taking in. And caffeine can be a very important cause of a lot of palpitations and chest discomfort and shortness of breath. Because if you start having, because the caffeine makes your heart go faster or makes your heart have abnormal beating, then that can make you short of breath, and that can give you chest pain. And then now you're anxious, and then sort of you can imagine how things, you know, can spiral from there. But I always talk to people about, you know, being honest about their caffeine intake, and people don't realize where they're getting their caffeine from. It's not just coffee, energy drinks, right? Even chocolate has caffeine to some extent. So always think about these things as well. And then, so you know, so that's the getting sort of evaluated and treated part for anxiety if you have it, or anxiety disorders if you have it. The other thing I wanted to talk about is how can you help manage this for yourself? And everybody's going to be different, right? I think one of the things that I like to tell people is, if you've been having the symptoms for you, let's say you've been having whatever symptoms you're having for years, right? Heart-related symptoms, if it's truly the heart, usually, again, this is very general, may not apply to you, they usually will start within a few months or so of people seeking help, if that makes sense. Because let's say somebody's 40 or 50 years old. If they're having heart issues, like actual heart issues, they may only start within maybe a year or so of them seeking help for that, right? Whether they're short of breath or having chest discomfort or whatever it is, they might notice, hey, I can't walk a mile anymore without getting short of breath, you know, or I can't do things that I used to be able to do a year ago without having chest discomfort or shortness of breath or things like that. So those are sort of newer symptoms in general. Again, I'm being very general here. People that have had anxiety-related issues, they've usually had them for many years. And I don't know if you can relate to this, or, you know, but if you've had panic episodes or whatever it is, you've had them for many years, right? Typically, again, I'm generalizing here. So that's one thing, right? So if you are having, let's say, your sort of manifestation of anxiety, heart anxiety, is chest pain, right? And if you have chest pain and you've had all of this testing done, right, and it's all normal, one way that you could sort of try to like talk to yourself is, first of all, you know, deep breathing exercises. I'm sure you guys are experts at that more than I know. But sort of like take a breath, take a step back, and try to like talk to yourself and be like, hey, listen, this is the same kind of pain I've been having for years, right? This is nothing different. This is all the same thing that I've had for so long. And I've had all my testing done. I've had everything, you know, echoes and a stress test and multiple tests done, and everything has been normal. And the likelihood that this is my heart is very low. And it's all the same symptoms I've had for a long time. And if you try to tell yourself that, it can help, because then, you know, you'll know that the last time this happened, right, you weren't having a heart attack, right? It went away and you felt better again. And the you know, when it happened a month ago or 3 months ago, again, it wasn't a heart attack. It was just sort of your anxiety showing through. And that's how I try to advise patients. I'm like, listen, you've had all of this testing done and your symptoms are always the same as your anxiety typically manifests. So, you know, it's unlikely that, you know, you just have to sort of tell yourself and convince yourself in whatever way you can. But if you have new symptoms, right, symptoms that you've never had before. So typically, let's say if you always have chest pains with your anxiety or palpitations with your anxiety, but now the chest pains character is different, right? It feels a little bit different. Or, you know, it was always just random, but now every time you walk half a block, you start having discomfort. That's different, right? So those are different symptoms that have a different character to your usual symptoms. And that's when you sort of should seek further help, because you can have anxiety and you can have heart disease at the same time. These are not mutually exclusive, right? So that's sort of how I like to explain this to people. Because if you've always had similar manifestations in terms of symptoms of your anxiety, it will generally tend to be the same moving forward if it really is anxiety, right? If it's heart disease, then it could probably is going to be a little bit different in some way. Now, I want to talk about panic attacks and heart attacks, because I think that's a pretty big topic that I get asked about all the time, right? Did you have a question? Did you want me to pause or something?
No, I think
Or
it's
can I
great.
keep going?
Yeah, keep going. Yeah, there were a few questions, but
So,
talk
so
about this, and then if there's time,
yeah, we can get. I saw some of that. We can get to that in a little bit. So, this is a topic that's very hard to talk about on social media, but I'll try. And obviously, this is very general. I get people coming after me for saying, "Why don't you talk about this? Why don't you talk about that?" Blah blah blah. I can't talk about everything, right? I have to keep it very general, and none of this is specific to anybody. Now, panic attacks and heart attacks can, or I'm using panic attacks in the general sense of the term. I think anxiety is a little bit. If you, I guess you talk about the specifics, there are some differences, but I'm just talking about like panic attacks in general versus heart attacks. Generally speaking, they can have similar symptoms, and that's why people get worried. That's why people think they're having a heart attack, right? Because both of them, people having panic attacks and heart attacks will generally have chest pains or just sort of feeling like shortness of breath and whatnot. And then they think they're having a heart attack, which makes the anxiety even worse, and then which kind of makes the symptoms worse. It's sort of like a vicious cycle. But there are certain things that people that are different between the two that can help you distinguish what might be going on. So first of all, if you have a history of panic attacks, right? If you've had panic attacks in the past, your attacks in the future are probably going to be the same. It's going to present the same way, right? It's going to be the chest. If you always get chest pains, right? If you always get really bad shortness of breath, it'll always be sort of similar. It won't be different, right? If you were having a heart attack, and remember, you can have anxiety and heart disease at the same time. If you were having a heart attack, that will probably be a different character of symptoms or pain, if that makes sense, right? It will not be the same. Now, again, it's not always true, but generally speaking, panic attacks generally will come on very suddenly, right? You could be doing nothing. You could be just sitting, watching television, and then it just happens like that, right? There's a very short or very fast, sometimes prodrome, where people will feel some sort of feelings before then, like a feeling of doom and gloom, right? And then you start having your chest pain or shortness of breath or whatever it is that your panic sort of, however it manifests. And the chest pains and panic attacks, again, very generally, not always, tend to be more sharp. They tend to be very sudden onset, and they will last, maybe, I don't know, maybe an hour or something, or maybe a few minutes to a few hours. Everybody is a little bit different. And they are pretty much constant in duration and in sort of intensity, meaning they don't, the pain doesn't come and go. It doesn't come and go. It kind of stays until it's gone, right? It doesn't sort of wax and wane in intensity. And the same thing for other symptoms. If you have palpitations, they will also come on very quick and come off very quick. So typically, it's a very discrete, if that makes sense, start and end of the symptoms, right? And they're usually done pretty quickly. They then go away, and then you're back to normal, right? Generally speaking. And people might be different, obviously. With heart attacks, it's a little bit different because generally speaking, heart attacks can also happen suddenly, but a lot of the times people will have symptoms that are brought on by exertion, right? So you are walking, let's say you start walking, and then you get to half a block and you start feeling a burning pain in your chest, or a very pressure-like sensation, or somebody sitting on your chest. Or, in women, heart attacks can present differently, but generally speaking, mid exertion, you're walking, and then the pain happens, and then you stop walking, you rest, and then the pain goes away, right? Or the pain can definitely start at rest. You could be watching TV and start having bad discomfort, but that is different from panic attacks in the sense that it is, first of all, it doesn't last an hour, right? It will come on for maybe 20 minutes or so, and then it will get better. It will get better, it'll get worse again, then it'll get better again, then it'll get worse again. So it's sort of like this sort of back to almost like a roller coaster. And that's related to the physiology.
Oh, wait, you got muted. Okay.
Yeah, so what I'm saying is that the heart attack pain is usually definitely at rest, but a lot of the times it's with exertion, and it will not be like a panic episode in the sense that it is not sudden onset, sudden offset. It'll sort of come and go, and it doesn't get better actually, right? It'll keep getting worse and worse and worse until you seek help. So you might have it over 2 days or over 3 days, but you don't have a panic attack that kind of continues over 2 days, right? That doesn't really happen. So that's one of the ways that you can help distinguish these two. But again, if you are concerned, just seek help. And I know that it's easy for me to say that because you can't just go to the emergency room every week, right? Because then people are like, well, if I'm going to the emergency room 5 times a week, then if I'm having a panic attack and I'm worried that I'm having a heart attack, then I'm going to the ER all the time. And it's hard, right? I'm not going to sit here and say it's easy to distinguish, but I can just give sort of these tips to maybe help people understand. I have a video on my TikTok actually goes into it's about 5 minutes or so, goes into more detail about how to distinguish panic attacks from heart attacks. But generally speaking, if let's say you've been to the emergency room 3 times the last month, right? And they said it was all panic, right? And it was probably, they were true. They were correct. I mean, it was panic. It was a panic attack. And you have the same thing again, right? So if you think about it and talk to yourself and be like, hey, this is the same thing I'm having that I've had in the past. It's the exact same. There's nothing different. It is probably more likely to be a panic episode than an actual heart attack, if that makes sense, right? So again, I think being in tune with your body and the way that you experience anxiety, heart anxiety, everybody experiences it differently. What your symptoms are, what your triggers might be, because a lot of people have very specific triggers, right? What your triggers might be, and sort of how you can avoid them as possible, and then managing it with either with as needed therapy or medication, whatever that is, and then sort of telling yourself that you've had all this heart testing done and it's all normal. Not to say that you may not have heart disease in the future, you definitely might, but I'm talking about in that moment. And then sort of recognizing some of the key differences between heart disease and anxiety and how they manifest. So that's basically, and also, the other thing I wanted to talk about is a lot of the times I get a lot of pushback on social media when I talk about heart anxiety because people say, hey, well, you're just gaslighting people, or you're just saying that you're just blaming anxiety. And that's not true, right? That's not true at all. I never say that. Yeah, and people just sort of don't even watch my videos a lot of the times when I'm talking about this, and they're just like, oh, you're just blaming anxiety. I'm like, no, that's not true. I've never said that anybody should automatically get a diagnosis of anxiety without a workup, right? Everybody should get a workup, testing as needed. But that being said, if everything is negative, you have to consider anxiety because that's a real diagnosis. That's a real condition. A lot of people sort of believe anxiety is sort of a fake thing, which is not true, right? If you read I don't know, Lily, if you read some of my comments, but there's a lot of people that believe that. They're like, oh yeah, you're just blaming anxiety. I'm like, dude, there's nothing wrong with the heart. I don't know what to tell you. If you're gonna, let me just put it this way. You can spend your entire life looking for something wrong to be with the heart, right? You can do that, but you will never find it if there is nothing organically wrong with your heart. And I think that a lot of people sort of don't recognize that. And one of the things I try to do is tell people that, listen, anxiety is a very real thing with very real manifestations that can cripple your life, right? It's not just in your head, obviously. It's a very real condition that can cripple your life, and people don't recognize that, then they're not getting treatment for it, and they're actually miserable, and they spend their lives looking for a organic heart issue when there may be none. And anyway, so I just try to raise awareness, and I think it's really important to talk about that. But I'm going to stop here. I think I've talked about for about 45 minutes now, but hope that was helpful.
It was so helpful. And I never feel like you're gaslighting. And I think that's why I really wanted.
Oh, I know you don't. I know you don't, but there's plenty of people that do. I don't really care. I mean, I'm going to talk about it because it has to be talked about, but it's a real thing. I mean, I don't know what else to say.
Well, and I feel like a lot of people probably listening would be very validated, and to say, have a workup, everything you're talking about, and now let's talk about it. And it's actually like really helpful. It's like, wow, my heart's okay. Okay, so let's talk about anxiety, and what I know with working with people is some people that experience health anxiety, they're more sensitive to normal things, that like normal heart palpitation, because they're so on guard. Well, a lot of people will get really worried about exercising or exertion, and it's like they get kind of overly sensitive to just normal things that they'd experience. But I don't want to talk too much about myself because I know there were some questions, and I also want to respect your time. And so I know that there were two people that had their hands up and a few questions in the comments. Do you want to answer comments, or do you want to ask have someone that has their hand raised ask a
Yeah,
live
so
question?
so there are some questions in the chat. I can just go over them. Is that okay?
Yeah, sure, great.
Yeah, so the first question I see is, Doctor, could you please discuss the role of medications in managing heart anxiety? That's the first question I see. I mean, so I'm just going to talk about medications from my perspective, the heart perspective. Obviously, if they're on psychiatric, like antidepressants or whatever, that's a different topic. That's not my purview. I don't really do that. But if they need to be on antidepressants or anxiety medication, they should be, and that should be managed by a qualified provider. I am not one. But in terms of heart medication, sometimes what I will do is I will prescribe people, sometimes depending on the situation, I might prescribe them a beta blocker like metoprolol. And the reason for that is just to help with, anxiety in the sense that they have fast heart rates, or they might have palpitations as a function of their manifestation of their anxiety. That can help them with their heart rate. It can slow things down a little bit, and it can sort of slow down and decrease the excitability in the heart that causes the palpitations. So even though there may not be an organic issue, as I said, it can still help control the symptoms. Now, obviously, this is very nuanced, and I don't do it for everybody, but I have to talk about side effects and talk about proper use and things like that. Sometimes I do even PRN, meaning as needed, right? You don't have to take it every day. But there are some, propranolol is used, is another beta blocker is used as well sometimes for anxiety. I don't really use that much, but beta blockers I will use sometimes. Well, this is all assuming that, I've done all the testing and everything has been negative. But the best treatment for heart anxiety is to control the anxiety. That's the best treatment. So Nikki is asking, what advice would I give to somebody with anxiety/panic disorder who finds out that they have heart disease to help them calm themselves and not panic every little twinge they feel? Okay, so this is a good question, right? So what this person is basically asking, that at least my understanding is, if I'm incorrect, please correct me, is you have anxiety disorder or panic disorder, and you have heart disease as well. You've had testing done, you have heart disease. And then how do you sort of like convince yourself that not every little twinge is going to be a heart attack, right? So this is a great question, and this is very applicable. It's also very difficult to answer because everybody is different. So what I will say is this: if you have heart disease, let's say you've had a stent or whatever, right? And you have anxiety disorder, every little pain feels like you're having a heart attack because you have a stent in your heart. You've had a heart attack before. One way that you could manage this is always think about what I tell my patients is, always remember the pain that you had during the time of your heart attack, right? So just before people come to me with heart attacks and I put stents in their heart, they have their own sort of specific syndrome, right? Or pain syndrome. They have chest discomfort or burning or whatever it is. People have different symptoms sometimes. I'm like, remember that. That is your warning symptom, right? And if that happens again to you, then you need to seek help, right? So people's anxiety will often manifest in very different symptoms. So their anxiety symptoms may be very different. They may be sharp chest pain, or they may be shortness of breath. But then when they had their heart attack, they actually had dull chest pain, or like a burning chest pain, or they didn't have a lot of shortness of breath, but they had like back discomfort or things like that. So if you just the key here is just try to be in tune with your body and your symptoms. And everybody's different. You just have to, a lot of the times I recommend people keep a diary, right? Because if you keep a symptom diary, that will help you identify not just sort of a pattern, right? Like, well, this happened at this time, this happened at this time, and you can identify patterns, but also possible triggers. And if you have a diary, the more information you have, instead of trying to remember and trying to think, oh, this happened or that happened, you have actual information written down. And that can really help you identify and clarify what your symptoms might really be. Right, so it's just always good to have a better understanding of what your symptoms are. And if you have the same symptoms that you did when you had a heart issue, and you have them again, that's when you kind of tend to get worried and seek help. Now, every little twinge, right? I mean, here's the reality: you turn over in bed, you're going to have a twinge, and I don't know, you pull a muscle exercising, you can have a twinge, and sure, you might think. That might make you think that you're having a heart attack. But I think the best way to go about that is always, the way that I've sort of managed it for myself personally, is I think it's always a good idea to take a little step back, right? And I think it's easy to get wrapped up and get sort of, and it's easier said than done, obviously, but it's very easy to get sort of like, how should I say this? Just sort of enveloped by this fear, right? The sudden fear that something is wrong. But if you sort of take a step back and think about it, I think you might be able to work through that. Even if you're having a heart attack, it's not like, it doesn't often happen like on television where you see this man suddenly clutching his chest and falls to the ground and he's unconscious. That's not how they happen most of the time. People often have like hours and hours of little, subtle pain that develops over time, and it gets worse and worse and worse. So it's not like you have it and then you die the next minute, if that makes sense, right? It's not like it suddenly starts at 5 p.m. and you're dead at 5:05. I mean, that most of the time, that's not how this works. The way this works is like you might start having discomfort at 5 p.m. and then you still have it at 6 p.m. and you still have it at 7 p.m. and you still have it at 8 p.m. and it's getting worse. And then you go to the emergency room, or you go to the emergency room 3 days later, right? So what I'm trying to say is that you will have time, right? There is time to assess your symptoms and try to think about them, as opposed to panic or anxiety sort of syndromes where the incident is very quick and it's done within a few minutes or maybe 30 minutes or so, and you don't have it again. So I think the biggest thing is just to sort of take a step back and try to think through it. Now, I'm not going to tell people how to do that because it's easier said than done, but instead of sort of letting yourself be taken by the fear, if that makes sense.
Yeah.
Then,
No, go
sorry.
ahead.
Yeah, I mean, that's the best way I can explain it.
I
And then,
think-
the one last thing I want to say is, this may be a little bit blunt of me, but that's how I talk to people, because I'm straight with people, my patients, and I'm like, listen, you probably had everything done. If everything is taken care of, right, with regards to your heart, like your stent, you've got a stent, we've taken care of it, it looks good, we don't have any concerns about it. All you can do is reduce your risk as much as possible and do what you can, right, to improve your health, and work with the doctor that make sure that everything looks good. And then all you can do is live your life, right? Because, excuse me, you could have a heart attack the next day. Nobody knows. Nobody has a crystal ball. So you can live your life and just sort of live it knowing that you've done everything you can, or you can have sort of marinate and perseverate about these feelings of anxiety, of having heart issues, and just live with them every day. Now, obviously, if this is a little blunt, people may not like it, but that's how it is. And I think if people can sort of just work to a point where they're comfortable with the idea that, hey, I've had everything taken care of, what happens. I guess life is unpredictable, if that makes sense. So that's one of the things that I talk to my patients about as well. Obviously, if you haven't had proper care, that's a different story. But you've had all the proper care, because even after I do these procedures, I put stents in people's hearts. They'll come back to me a week later. I get messages from them saying, "Hey doc, I'm having palpitations. I'm having this weird pain. I'm anxious because I'm worried that something's going to happen, or my stent's okay or not." So I see that all the time in my practice. And a lot of the times, actually, it's just really just me talking to them and me reassuring them. So it's not even medication, it's just reassurance. A lot of the times that's what's needed. Obviously, I make sure that there's nothing wrong, but reassurance can go a long way, whether that comes from a therapist or your doctor. I think that can help a lot. So some people, it's taken me a year of reassurance for them to sort of finally feel comfortable with, but it is what it is. I can go to the next question if that's okay. There's this, can you explain a Gadsden scores? That's a calcium score. That's kind of out of the scope of this talk. That's not about heart disease, anxiety and panic, heart anxiety. I talk about it a lot on my social media. And same thing for menopause and uptake in cholesterol. Again, that's a menopause and cholesterol management is a very complicated topic. I can't talk about it here because everybody's different. And there's a lot of opinions about it too. So I'm going to skip that question because it requires a lot of nuance. And there's no one right answer for everybody. So I'm going to skip that. And also, this is not related really to this talk. Anxiety that manifests through the heart symptoms cause damage to the heart in the long term. Even if I know nothing is wrong, I sometimes worry that the heart is working so hard that it could cause damage / condition in the future. And that's actually a great question. I get asked that a lot. The answer is probably not. And I say probably not because obviously there's no certainty, no such thing as 100%. Now, probably not. I think I have not seen any long-term damage to the heart from just having anxiety. Now, it's not good for you in the sense that the anxiety can lead to other issues. For example, if you have uncontrolled, anxiety for a long period of time, it's sort of that heightened state of, adrenaline, noradrenaline. It can lead to high blood pressure, increased risk of diabetes, and all those things down the road that can then cause heart issues. But directly, no, I would not say that I haven't seen that happen. But if that helps, you guys deal with it better. You sometimes worry that the heart is working so hard that it should cause a damage. Well, as I said earlier in the talk, your heart beats over 120,000 times a day. And you don't even know that for most of the part. It just does it on its own. So for a machine that does it 120,000 times a day, 7 days a week, 30 days a month, 31 days a month, or over a lifespan of 80 years, your heart has beaten over 3 billion times. So it's a pretty remarkable, resilient, machine, the heart, and it can take a lot. So I would not worry about it working too hard. Now, if you have an abnormal heart rhythm, if there's an actual abnormality, that's a different story. I'm not talking about that. I'm talking about sort of, and the heart is developed and it is adapted to times of stress, and anxiety is sort of a stress as well. So I would not worry about it working too hard or getting worn out that way. Again, got a question about community screening. Sorry, guys, these are not relevant to today's talk. I talk a lot about this on my social media, so you can look at there, look there as well. Blood pressure, anxiety. Always had a normal blood pressure, but recently, when anxious, a doctor has been elevated. Okay, so this is a classic story of white coat hypertension. What that means is that when you go to the doctor, your blood pressure is elevated. And then when you are at home, your blood pressure is okay, right? Meaning, or even normal. And white coat hypertension is basically just a lot of, sometimes you have anxiety that going to the doctor, we're worried, what's the doctor going to say? And it's an unfamiliar, environment, and you don't know what the testing is going to be like, and all of this stuff. And it's just, I don't really trust blood pressures that are taken in my office for several reasons. First of all, because of that anxiety, because people are already in a heightened sort of anxious state because they don't know what's going to happen. Also, the best way to take your blood pressure is to take it at home when you are resting, at least for 15 minutes or so, which means you're just sitting on the couch, you'd be watching TV, you're not stimulated, you're not angry, you're not upset. You just didn't come in and drag the groceries from the car, right? Because all those things increase your blood pressure. You just got to be chilling on your couch, something like that, or resting for 15 minutes, and you take it the same way, you take it the same time of day, every day that you take it. And that's how I tell my patients to take all their blood pressures. So I think everybody should have a blood pressure cuff at home. These are, you can get them for cheap, and do it consistently that way. So I don't trust a one-time reading in my office for high blood pressure. I always have, we call this ambulatory monitoring. So I ask the patient to check it at home, and then they make a list. I ask them to write down a couple weeks worth of readings, right? Check your pressures at the same time every day. So it's not like 8 p.m. one day and 8 a.m. the next day, or 9 p.m. one day and 9 a.m. the next day. Same time, because your blood pressure will change. It is a dynamic thing. It's normal. Your heart rate and blood pressure, these are dynamic numbers. They change from minute to minute, depending on what you're doing. And I don't care about one or two eccentric, meaning outliers, because it can go up and down. What I care about is the general trend. So if you have a month's worth of readings, I care about, are they going up in general? I don't care about the individual outliers. I care about the trend, upward or downward. That's what I care about. And that's why you need multiple readings. The more the better. And at the same time, every day with in the same context, meaning you're not just, you didn't just come and haul groceries, because your blood pressure is going to be elevated at that time. So I don't really care about well, it's important. The office number is important, but if you're worried to take the blood pressure at home because you'll also be anxious, you'll be less anxious than the doctor, hopefully. So, than at the doctor. So at least you should have a better reading. So hopefully that helped. And then, so here's the thing. The other thing is, I'm not taking my blood pressure at home, but you feel like it's probably normal. I don't know what the signs of high blood pressure are. So this is another very important thing I want to talk about. Because a lot of the times we are afraid to get things checked because we are worried either what they're going to show, or we think that it's going to be normal, so we don't get them checked. But then that's not helpful, right? Because you don't know what you're dealing with, right? So and I have the same thing. Whenever I have to get my blood work checked, I push it off because I'm like, I don't want to know what's going on, right? But that doesn't help. right? So you have to understand that you have to know. So if you know your cholesterol and is abnormal, you can do something to bring it down, and you can do something to protect yourself, right? So if you never check your blood pressure because you either are afraid that it's going to be high, well, then you're never going to know, right? You're going to have, you could have a stroke 10 years down the road, or it could be normal, sure, but you didn't check and you don't know. So what you don't check, what you can't measure, like you can't improve on, right? It's the same thing as writing down every single symptom you have in a symptom diary. So when you say it, you feel like it's probably normal, well, you don't know that until you check it. And if it's normal, great. That's one thing you get off your list. But if it's not normal, then you can work to, get it down. And at least you know now as opposed to before. So I think that's very important, that we have to be open to just getting these things done.
Yeah.
Anyway, so I think that's probably most of the questions. We're coming up to an hour, but
Yes, yeah.
I'll shut up for now.
No, I just wanted to respect your time so much, and thank you. And I have diabetes, and so I usually wear a continuous glucose monitor, but if it's in the time between, sometimes I don't want to know. And I'm like, this is information. So how I think of it, and when I talk to my clients, if they get nervous about testing their blood pressure, it's like, it's just information. And I think even seeing if it gets high, can I relax? How does this change if I do? I noticed they took my blood pressure at the dentist, and I usually have normal to low blood pressure, but it was a little bit elevated because I was like,
Yeah,
I was checking my email and I was irritated,
yeah,
and I said, wait, I know how to calm down. And I
yeah,
settled down and it was normal. And so
yeah,
I like that we were talking about multiple readings, and saying, I'm going to look at it over a month, this one reading, and
yeah.
so,
Yeah,
but
and
also,
here's the other thing I wanted to bring up, because you brought it up, is there are very few things when it comes to the heart, very few things that are going to kill you in 10 minutes. Okay. Like from the time that this started, very few things. I mean, these are things like an aortic dissection, or even then you're going to know something is going to be like, you're going to absolutely feel like the worst pain, right? That's different because you're going to know that something is wrong when those things happen. Things like heart attacks, dissections, pulmonary embolism, et cetera, et cetera. These are very, very few things that can kill you very quickly. Most of the time, and the reason I'm bringing this up is because a lot of the times people will see their blood pressures up at the office, right? One reading, and then this sort of sets off a very vicious cycle of, oh my God, my blood pressure's up. What's going to happen? I'm going to die. Or they have a random twinge that doesn't come back, and then they think, oh, I'm going to die, right? Or whatever it is. So if you try to remember that, okay, well, you have, as I said, even a heart attack will develop often over hours and hours and hours. So you have a lot of time to be like, you know what, maybe this doesn't seem like my panic, right? Or my anxiety, because it hasn't gone away, or it doesn't feel like my usual stuff. Or usually when I have something like this, it goes away very quickly, but it has persisted for hours. Maybe I should go get it checked out, right? If that makes sense. So you have a lot of the time, you'll have time to sort of step back, gather yourself, or sort of calm your nerves. Well, however you do that, take a deep breath and try to work through it, right? Because you have to be able to work through it. And as you said, you're sort of like, yourself, right? You sort of like work through it. So yeah, if you try to remember that there's one reading, I don't care about one reading. It could be 200. I don't really care. What I care about is a trend. And then again, the human body is very resilient. And there's very few things that will seriously harm or kill you, at least when it comes to the heart, very quickly. Most of the time, you have time to think through things.
yeah.
Anyway, because that's what the idea is, right? Every little thing is like an immediate life-threatening emergency, right? That's what the whole thing is. That's what the idea, sort of like fear is. Well, that's not true, actually. Most things are not.
Yes. Well, and also when you go to that fear and you go freak out, you get more confused. If people
Yeah,
get in more of a habit of not going to this brain habit, fight or flight, worst case scenario, you settle
correct,
down, and then you remember, look at that. Then you can have your own reassurance. As you said, wait, I've
correct,
had the test, I've had
correct.
this, doctor says this.
Yeah,
Like, people have that in them, and then they can get into that habit of like pausing, letting their thinking settle, and then they're more clear.
yeah,
Because that's what
yeah,
the final thing that I'll
yeah,
say is, when we can recognize how anxiety, our thoughts get really distorted, but they're
yeah,
temporary and they can change. And
yeah,
then you have clarity. Yeah, this is different. I am gonna blah, blah, blah. Or
yeah,
everything settles and you're like, um, I work with a lot of people that also fear going insane, and it's kind of similar. Sometimes it's like, wait, this is as worse as it gets. I'm not suddenly going to lose my mind. This is always how it feels. Like this is panic, this is anxiety rather than a heart
Right,
attack where I'm losing my
right,
mind.
right. And
They
that's
take,
absolutely correct. One of the things that I like to teach people is, a lot of the times it's SVT that triggers all of this. And for SVT, there are some, if you have it, there are some things you can do at home. They can help you break out of it, right? So things like Valsalva maneuvers, like bearing down really hard, as if you were taking a bowel movement. That's one example that can actually, not always, sometimes break you out of it. The other thing I do is I have people take a syringe, like a 20 cc syringe that you can buy it just off of Amazon, and try to blow into the open part of it and against it. So you're basically, if you look it up, how to blow into a syringe for SVT, you're basically increasing the pressure. It's kind of like a Valsalva maneuver and can help break the SVT as well. If that's what you have, it may not be that, but also it's a distraction, I think, in a way, from thinking about it. It distracts you, right? And I think that few seconds of distraction can often be enough to kind of like let you break out of it. But for people that have SVT, it doesn't work for other rhythms, but SVT, I recommend these things. So if you have it, talk to your doctor about, maybe some of these things you can do at home. And they may not always work, but sometimes they work, and they might save you a trip to the hospital. So
yes.
why not?
Thank you so much for this. I know that a lot of people were saying how helpful this has been in the chat. So
Yeah, no, thanks for
can't thank
having me.
you enough. Thank you. And I will.
Yeah, and then obviously, you guys can check out my TikTok, my Instagram. I make content like this. If there's something you want me to talk about, send me a message and I'll see if I can make a general video that's educational for everybody. Happy to do it.
Okay, well, thank you. Your videos are so great. And so I just can't thank you enough for coming on here. I'll post this on my YouTube and send the link. So if anybody missed it, they can come on and watch this recording because it's just so incredibly helpful. Thank you so much.
Awesome. Well, thanks, guys. Have a good day.
Bye. Have a great night.
Bye-bye.
Thank you. Bye, everybody. Thanks.